Harris, good morning.
Good morning, thank you for having me.
Your first interview here since becoming Minister for Health at the age of 29.
That's right.
What was your reaction when you were told you were getting the job?
I was somewhat shocked. I had some bit of a sense that I may have a role to play in government. I had obviously served as a Minister of State in the Department of Finance and had been involved in the government formation process. So whilst I was hopeful for a role in government, I wasn't necessarily expecting this role.
Did you want it?
Well, you know, and nobody probably ever believes a politician when they say they want to be Minister for Health, but I genuinely do. Because I believe there is probably no department in the government in which you can make a more positive impact in people's lives. And one of the lessons that I heard very clearly from the people during the last general election was, yes, it's great you have a recovering economy and, you know, an acknowledgement of what the last government had done in relation to the economy with the people, but also a frustration that they hadn't seen that benefit in terms of public services, and a very clear message from the electorate. You know, great that you fix the economy, please keep the economy on track, but will you please put the economy to work for vital services like the health service? And I think I've come into this role now at a time when government has clearly heard that message, the electorate have delivered it loudly and clearly, and now it's my job to try and implement it.
You're Minister for Health. What's your plan?
Well, my first plan is to try and do something that has never been done before. And I'm conscious when I say setting up a special committee that your listeners will probably yawn and say, here we go again, another committee. But Gavin, Ministers for Health come and go. People stay a couple of years, governments change, politicians change, formations of government change. What we need now for the health service is a 10-year vision. We need a singular plan that, regardless of whether you're a Fine Gael deputy or a Fianna Fáil deputy or a Sinn Féin deputy or a Social Democrat or an Independent or anybody else or Labour, that you can say, this is where we want the Irish health service to be over the next 10 years. Here's how we want to get there, and crucially, this is how much it's going to cost. If you asked me, or indeed any other politician, how much would it cost to adequately fund the health service over the next 10 years, it's almost an impossible question to answer at the moment, because we have not yet designed that roadmap. So today in the Dáil, I will be moving, and I want to acknowledge, by the way, the huge support from opposition TDs, and particularly the role played by Deputy Roisin Shortall. I will be moving a motion to establish a special committee in the Oireachtas to look at a singular vision for the health service over the next 10 years. That committee will be able to hear witnesses, get expert submissions, and report back to the Oireachtas and back directly to the Ceann Comhairle within 6 months. I think that provides our frontline staff and our patients with a degree of certainty as to the direction of travel, regardless of political events. We're in a very new political dynamic in terms of a minority government, so if anything can come out of it, positive can come out of a diverse Dáil, I think all of us stepping up to the plate to try and put a singular vision in place is that.
When your party came to power 5 years ago, after a very long absence,
yes,
you set out a 10-year plan then on health, promising to be, and I quote, the first government in the history of the state to develop a universal single-tier health service guaranteeing access to medical care based on need, not income. No discrimination between patients on the grounds of income or insurance. Is that still the plan, or judging from your programme for government, is it gone?
Well, I think the first thing to say is that there isn't a majority in the Dáil for universal health insurance. And to be quite frank, I think we saw a lot of data during the last 5 years that showed significant concerns as to how that would be funded. What I now want the plan to be is universal health care. My predecessor, Leo Varadkar, started this with the expansion of free GP care. Well, the World Health Organization talks about universal health care being a health system whereby we reduce the amount of unmet health needs, whereby regardless of income you can access the public health service in your country. We have many good examples of that. We've also started, as I said, the rollout of free GP care. We started that with the under 6s, the over 70s. We'll go to the under 12s later this year. But there is so much more to do. But the point I'm making in my opening comments is, regardless of what Simon Harris wants to do or anybody else, we need to have a political and ideally a societal consensus over the next 10 years. So that is my priority,
yes,
rather than investing.
Is the old plan gone?
The plan is exactly as I outlined it now.
So the old 10-year plan is gone?
Yes, because never before, let me be clear, we've had 10-year plans from parties before. We've never had a 10-year plan from all parties together, and that's my absolute priority.
When will free GP care be extended?
The programme for government gives a commitment to extending free GP care to all children under the age of 18 during the lifetime of the government. That is the priority. The intention is to extend free GP care to all children under 12 this year. That remains the plan. I do think it's important to say, though, that as a crucial building block of that is going to be a new GP contract. I think the state needs to rebuild, quite frankly, its relationship with GPs. They are on the front line in our communities every day. They are in need of a new contract, and quite frankly, the state is in need of a new contract. So whilst I wish to roll out free GP care to under 12s this year, and it is funded for in the estimate for this year, I think we are going to need to look at a new GP contract in the context of addressing all of those issues.
You're also facing, as indeed are 500,000 people, facing long waiting lists, and One of the reasons why there are such long waiting lists, to quote the old 10-year plan, is because there is such an unfair, unequal and inefficient health system. How are you, or are you, going to end that unfairness?
Well, I think one of the reasons that there's such a long waiting list is because we clearly need to reinvest in our health service, and our health service, like many parts of our public service, took quite a battering during the years of economic recession. We're now in a period of reinvestment. What I want to do, and what the Programme for Government clearly states we will do, is reactivate the National Treatment Purchase Fund. Now, let me be clear, my absolute priority is the public health service, not utilising the private health service. However, when you have very long waiting lists, like you rightly point out, there is a merit in using the National Treatment Purchase Fund to try and identify particularly difficult cases, and we've seen some of them in the media this week, where people are on waiting lists extraordinarily long time and in extraordinarily difficult pain. So I intend to reactivate the NTPF this year. I intend to roll out a programme to begin to address waiting lists this year, and I intend to build on it in budget 2017.
But people will still have quicker access to hospital health care on the basis of their insurance. Are you going to end that unfairness?
Well, what I want to do is make sure that whilst people can always, and in most countries, continue to purchase private health insurance, should that be their wish, that people aren't at a significant disadvantage if they're reliant on the public health service.
Your predecessor said the HSE would be disbanded within 5 years should the government be returned. Will you abolish the HSE?
Well, there's two commitments in the Programme for Government in relation to this. One is the dismantling of the HSE, and the second is the cross-party committee that I've outlined that I'm setting up today. I want to make sure the order in which we address these issues is the cross-party committee. First, develop the political and societal consensus, and secondly then look at the issue of the HSE. Let me be clear though, I am not going to invest significant time in structural reforms unless there is benefit in those structural reforms directly to patient care.
Sounds to me like you might not abolish the HSE.
Oh no, what I'm telling you right now is my absolute priority is on patients and patient care. There is a need, I believe, to continue the process of dismantling the HSE. It is my view, it's my party's view, it is the government's view. I think it is too bureaucratic, and I think there is benefit in devolving decision making to local powers and to hospital groups. I think that is a journey of travel that's going to take some time. In this minority government, and for me as Minister for Health, my priority is in addressing some of the serious acute issues that face patients and frontline staff today.
One of those is long waiting times in emergency departments. You met with the emergency task force on Monday. You said you wanted to plan for the winter,
yes,
albeit that there are still around 250 people waiting on trolleys and chairs and other means in emergency departments as we speak this morning.
Yes.
It's already the plan for emergency departments. There are already a recruitment embargo for some hospitals that are facing budgetary pressure at the moment. Will you release that recruitment embargo in order to allow those hospitals to prepare for the winter?
There's not a recruitment embargo. What there is an old-fashioned value that people obviously have to have some sort of cognizance to the budget in which they're operating. I heard earlier in your programme the talk of the need for more Gardaí, and I'm quite sure there is, and the government's committed to increasing Garda numbers. But obviously the Minister for Justice and the Garda Commissioner have to operate within the Garda budget. Similarly, hospitals within the Irish Health Service have to be cognizant of the budget as well. If you spend more money in one area, it deprives another area of the health service. However, let me be clear, in relation to emergency departments, the vacant nursing posts in emergency departments can still be filled and are actively being recruited today. Hospitals can still and must still and should still continue to actively recruit for vacant funded posts, and indeed where somebody leaves a funded post, actively seek to replace it.
But some of them are already at budget or at budget or approaching budget for this year as it is. They would say there's an effective recruitment embargo in place because they don't have the money to hire new staff.
Well, it's their pay bill. Their pay bill is not being confused with their non-pay bill, so it's only where they've expended their pay bill and other decisions. Local hospital managers do have to be responsible for the decisions they make, who they wish to hire and what they need. But let me also say clearly, we need more frontline staff. You would get the impression sometimes in reading newspaper articles and listening to commentary that there's less people working in the health service. We have increased the number of people working in the health service last year. We will increase the number of people working in the health service this year, and it is my intention to continue to increase the number of frontline staff. I would be the first, though, to acknowledge that we have some way to go in this. We lost about 12,000 people working in the health service during the recessionary years. We've put back about 6,000, so we're only halfway there.
And according to the Irish Nurses and Midwives Organisation, this has already been the worst year in terms of the 12 years they've been recording for trolley waits, chair waits in emergency departments. When do you expect to meet the 6-hour waiting time target for a bed set out in your programme for government?
Well, that is a commitment in the programme for government over the lifetime of the programme for government, but I want to try and get there. I want to get there as quickly as possible. I think we all want to get there as quickly as possible. It's a commitment to deliver during this term of government, Gavin. But just we need to be careful in terms of how we report figures. You can't ignore the fact that almost 7 ED admissions, people turning up at accident and emergencies, is up almost 7% this year. There are more people coming through our emergency emergency departments this year than last year. There are huge pressures in terms of demographic pressures. We have an ageing population. Over 85, people over the age of 85, I think, are accounting now for 14% of the people turning up in our emergency departments, despite the fact that they're 1.4% of the population. We have demographic pressures here. What I want to do, though, and this is a very important message I want to deliver. I'm the Minister for Health, not just the Minister for Acute Health. If we're very serious about reducing the pressure on emergency departments, if we're serious about the Winter Initiative, this is an important point. We need to look at primary care, we need to look at social care, we need to look at keeping people out of hospitals. That's going to mean more home help, it's going to mean more long-term stay beds, it's going to mean more respite, as well as building the capacity in terms of beds and staff in our acute hospitals.
Just over 6% of the health budget is spent on mental health. And of the extra money given over this year, 35 million, over a third of that was taken away or diverted somewhere else. Will you give that 12 million back to mental health?
I'm looking at the issue of mental health as I'm looking at the issue of all of my budget in the context of the health estimate that will need to be brought through the Dáil in the next fortnight. But I would make this point. There's 35 million euro, which was ring-fenced absolutely, for the provision of mental health posts within the health service. Those posts, we have had difficulty in recruiting all of those posts. That, therefore, the decision was left to the HSE in terms of, do you actually expend that money on another area? And this was highlighted in the service. This was highlighted in the service plan in black and white, that this would be a time-related saving. The full 35 million euro, will go into the base, will go into the starting point for mental health.
But you're not giving it back this year, no?
I'm looking at the issue now. I don't want to be definitive on it until I look at my estimate, which I'll have to bring through the Dáil in about the next fortnight.
You're meeting today with a HSE drugs committee to talk about approving paying for the use of 2 drugs for the treatment of advanced skin cancer. Is the decision ultimately yours?
Just not to be pedantic, but I'm not meeting them, but they are meeting today. The HSE drugs group is
Sorry,
meeting
you
today.
called them to me today.
Sorry,
yes.
I did indeed, yes, and they are meeting today. Quite frankly, the decision is likely, if they recommend the drug, to be mine and to be government's. And this is not a position that I feel comfortable in. I don't think it's a position that well serves patients or their families. If I was a patient dependent on this drug, or a family member, I wouldn't like any politician making a decision in relation to how to fund this. We simply have to put a better policy framework in place. But my absolute priority today in relation to the specific cancer drugs and the concerns of patients who require them is for this process to be brought to a speedy conclusion. The HSE drugs group will meet today. The HSE drugs group will then report to me, and I will then obviously have to make a decision in terms of if there's a need for extra funding going to government on that. But my absolute commitment is to conclude this process.
When you say extra funding, will that be money that will come from with existing HSE resources, or will it have to come from somewhere else?
Again, it's too premature to say, but I think there may well be an onus to try and find that funding should this be needed. But there has to be a better way of doing this. There is a huge pipeline of new drugs that our patients will quite rightly demand and require. We have to work out how to fund them. I've heard interesting ideas from lots of politicians in recent days from different sides of the aisle in terms of special funds and how you do that. That all merits consideration. But we've also got to be honest, where are we going to find the money if there's a pipeline of new drugs that could cost potentially 300 million euro per annum on top of the health budget? I think the starting point has to be, we have to accept that we're spending more on drugs in this country than other countries, and we need to drive down those prices, and you'll be aware of the actions that I've taken in that regard in recent weeks. 2
babies died at Cavan General Hospital this week, while most of the reviews into other baby deaths of the hospital in the last 4 years still haven't been completed. How can expectant women be assured that Cavan has learnt lessons from past deaths?
I think this is a really important point you make, and obviously my thoughts and sympathies and everybody's go out to the families affected in Cavan, and I'm very eager to obviously protect their confidentiality at this sensitive time. But you're right, there's an onus on the health service to be able to reassure expectant mothers, indeed expectant parents, about the safety of our maternity services. I noticed the comments of Dr. Coulter-Smith in the Irish Times today, a former master of the Rotunda, though, asking for a sense of calm, I suppose, and to allow the facts actually emerge in this, and I would echo that call. I will receive reports in relation to those 2 incidences by the end of this week. I've asked my officials to keep in very close contact with the HSE. The hospital group is currently carrying out reviews. Once I receive those reports, there will be an onus on the health service to work out a mechanism in which they can reassure people. I would also, I suppose, point out that sometimes when there are reviews, they can be subject at times, as they have in the past, perhaps to legal challenges, to delays in relation to coroner's inquests, and they are practical realities. But as Minister for Health, I have a duty to try and provide a reassurance through the advice available to me to expectant mothers, as you rightly say, and I hope to be in a position to do that in the coming days, and I want to receive those reports by the end of the week.
The Taoiseach and Minister for Justice Francis Fitzgerald told the United Nations Review recently that a Citizens' Assembly will consider the 8th Amendment on abortion as part of its remit, and that's provided for in the programme for government.
Yes.
You're Minister for Health. In your view, is abortion a health issue?
Well, obviously, insofar as any of these issues impact on the health and well-being of a mother, absolutely it is a health issue. The commitment from the government is very clear, as you've correctly said, and as was outlined by my colleague the Taoiseach. The government has said it will establish a citizens' assembly. I think this is the appropriate way to do it. I think the last Oireachtas showed that you can have a rational, informed discussion about abortion in the context of the Protection of Life During Pregnancy Bill, and I was obviously part of a government that did address that issue that hadn't been addressed. The citizens' assembly will be set up. It's going to be set up by the Department of the Taoiseach, to the best of my knowledge, will be set up in the coming months, and I await its deliberations.
Not your brief, but it is a current government issue of the day. We were talking about water earlier on,
yes,
and that EC ruling that notes that we spoke about, that Lynn Boylan, this is in response to Lynn Boylan of Sinn Féin, the MEP's question. Are we free, are you free as a government now, should that be the will of the Dáil, the Commission and all the other commissions you set in place, are we free to get rid of water charges if that's what we want to do?
Well, the view of my party is very clear, as you know, and I don't want to go there, you don't want me to go back there in relation to water charges. There's a clear process in place now. One of the terms of reference, and this is directly relevant in relation to that process, the expert commission that's going to look at the whole issue of water charges, is to look at our international and European obligations. So that commission, that expert commission, which I don't wish to preempt its work, is going to have to address that very question. What are Ireland's international and European obligations in this regard? My colleague, Minister Simon Coveney, whom I spoke to last night on this issue, has informed me that he too intends to speak with the European Commissioner in relation to this. Ireland is not, though, abolishing water charges. Ireland is putting a process of suspension. What's your view of the ruling that was of the judgment that was given yesterday? What's your interpretation of that? Does that leave us free to get rid of water charges or not? Do we have that flexibility or not? My own view, in addition to being in support of water charges, has been that is and remains that there's an obligation on Ireland in relation to water charges. From a European level. That seems to be what the European Commission said yesterday.
Do we have the freedom to get rid of them if we want to?
The European Commission has outlined its view in relation to that. I want to let the expert commission interrogate that. I see very little point in setting up expert commissions if I'm going to try and do the work.
Simon Harris, Minister for Health, thank you for coming into us this morning.